in association with JK Tire and Lloyd LED TV.
This is TV18 and you're watching CNBC TV18.
Presented by ICICI Lombard Health Insurance. Journal partner, The Indian Practitioner. Exclusive media partner, Medgate. Magazine partner, Drug Today Medical Times. And Healthcare Executive. On-ground partner, Inox.
Focus. Ideate. Innovate. Enable.
Good evening, ladies and gentlemen, and welcome to the Healthcare Summit 2014. India's healthcare industry is exploring new frontiers in medical science and technology. The Healthcare Summit 2014 aims to give you all a comprehensive view of the healthcare industry as it stands, its challenges, and the future of the healthcare space in India. To deliver the welcome address, please join me in welcoming Editor, Special Projects, CNBC TV18, Mr. A.B. Ravi.
Before I talk about tonight's event, I just thought it was opportune to talk about how the idea of the Healthcare Summit came into being. 5 years ago, CNBC TV18, along with ICICI Lombard, embarked on a journey to felicitate and recognize India's best healthcare providers. Thus was born the India Healthcare Award in 2010. This award honors, recognizes, and encourages the healthcare service providers who are doing a great job in the given situation. This award, now in its fifth year, has become the most definitive award, almost like an Oscar, I would say, in the healthcare space. While the India Healthcare Award honors and salutes the hospitals and doctors for their tireless dedication to the cause of healthcare, there remained a strong need to create a forum that would bring all the players from the healthcare sector on a single platform to present their ideas, breakthroughs, processes, innovations, or research papers. Any development that has helped reduce mortality rate, or reduce pain, or has reduced processes. And more importantly, the outcome of these development has resulted in reducing cost for the patient and thereby has made healthcare affordable, accessible, and available. Thus was born the Healthcare Summit in 2013. Our endeavor is to make this summit an annual feature like Davos, which every business leader keenly looks forward to attending year after year. And to my mind, that looking forward to is possible only if there are strong takeaways or learnings from the summit. To ensure that, we have some of the finest minds from the healthcare sector gathered here tonight to share their experiences, their contributions. In other words, how they or their organization have made differences to the healthcare sector positively. I'm sure these eminent people will make the evening very stimulating. Thank you very much.
Ladies and gentlemen, please give a warm welcome to your first speaker, Vice Chairman and Managing Director of the Asian Heart Institute, Dr. Ramakant Panda.
I'll briefly talk more about the overall scenario rather than very specific issues. We have made rapid strides in the last 20 years. But if you look at it, Human Development Index, we are one of the lowest in the world. We have problems at either end of the spectrum. 20% of the world's disease burden is in one country alone. We have disease on either side. We have got diseases of the infection, malnutrition, half of our women are anemic or malnourished. 4,000 to 5,000 children die every day from diarrhea and other related issues because of the open defecation and other unhygienic practices. On the other hand, we have got diseases of the plenty. Very quickly, we are becoming the heart disease and diabetes capital of the world. 35% of the population suffer from diabetes heart disease, which is going to go up to 57% in next 15 years. And the loss in last 10 years is $237 billion. We are talking about one hand we have diseases of plenty, other hand we have diseases of the poor. Now, we don't have any, look at the infrastructure. We have got 0.7 doctors per 1,000 population, 1.3 beds, much lower than world average 2.7, WHO mandate at 3.9. All the beds are mostly in private sector. 70% population lives in the villages, 75% of beds in the private sector, mostly urban, semi-urban areas. Affordability, accessibility of majority, 70% population cannot afford, don't have coverage. Only hardly 20-25% have coverage. Every year, 39 million are pushed into poverty. So there is a huge problem in this country of excess, poor. We have a problem, as I said, of bullock cart as well as Mangalayan, so both. We have some of the best hospitals in the world. We have some of the best doctors, best infrastructure. We get 10% of the medical tourism, big buzzword, yet 70%, 75% patients cannot afford, don't have basic health care facilities. So for India, I think to have quality health care, affordable, accessible, and which is sustainable, is very important, sustainable. How much we can afford? If you look at cardiac care alone, USA spends in the hospitalization alone around $170 to $200 billion. We have got 4 times population, 3 times disease burden. We need to spend $2 to $3 trillion more than the GDP of the country. So we cannot afford to spend that kind of health care. So we need to have the best health care. That is where I think innovation, bringing down the cost, plays a very, very important role. Now if you look at it, I think one of the best model will be PPP model. Unfortunately, even though it's pretty successful in all other areas, healthcare, it is a failure all over the country because the stakeholders cannot agree to deliver the healthcare which helps or which is satisfied to everybody, whether it's policymakers, government, bureaucrats, providers, private or public healthcare, payers, public, all of them need to be in the same page. You need to get private players. Private players also need to get a return on their investment, otherwise nobody is going to put money. Same time, you need to provide equitable, accessible health care. Same time, also we need to look at how to cut down the cost. There are a lot of other areas where the cost can be cut down. One, of course, is getting the private and PPP model. Other area will be medication. Medication costs almost 70%, 70 to 75% of the out-of-pocket expenses are on, or healthcare expenses on medications. That is where generic medicines, you don't need to go for the most expensive, branded medicine. Generic medicines can be given for a same disease treatment. But problem here is we don't have quality control. We don't know how was efficacy of those medicines. The other areas, again, where easily you can do reusing disposables. You don't need to, in a country like us, you can use, if you are maintaining a very high quality re-sterilization process, you can easily reuse. You can cut down the cost. Same thing, another major area where is the cost of medical education. An average doctor, if I look at in today's time, everybody scored 98, 99% mark. 1% mark, there are 5,000 good students who can get into government college where they can get free treatment. So they have to spend 50 lakh to 1 crore rupees. I think it's much less. I'm talking probably more than 1 crore rupees just MBBS. You go on MD, another 5 crore. You want to do another one, another 5 crore. So you spend 10 to 11 crore. By the time you come out, most of the middle class, the parents have sold or taken bank loan. What do you do? First thing, you come out 35. Your friends who are in the other sector already earning for 10 to 12 years. The first thing you do, how to get your money back. Ethics goes to the back burner. You first thing you start getting court practice, all those things. You need to attack all those things. Unless you do every single aspect, you are not going to get equitable, accessible and quality health care at affordable cost. We need to allow the private hospitals. I got trained in a private hospital in USA. 80%, 90% of the degrees are given in private hospital. You can easily do, you can cut down the cost completely. There's zero cost of education. So these are various ways you need to look at it. Innovative ways look at insurance. We need to have a complete universal healthcare insurance need to be provided the whole country. You can't, hardly 25% of the population is covered. We still think healthcare is still we have a socialist mindset that is the state subject. We don't spend money. We are ready to spend money on our houses. We are ready to spend on clothes, food. But when it comes to healthcare, we don't want to buy insurance. So that kind of health-seeking behavior also need to change. I think finally, very, very important to sustainable healthcare, we need to change our mindset from disease treatment to healthy living. So we need to completely change. Policy planners, hospital, doctors, all of us have to change our mindset from treating a patient, the moment the patient out of the hospital, our responsibility over to educating the public, educate the patient, bring a healthy lifestyle. Thank you.
Surround your senses with the world's first curved UHD TV from Samsung.
Wisdom is the key to financial success. Presenting NSE FinWiz Season 2, powered by CNBC TV18, an investor education initiative by NSE IPFT, helping India's young workforce explore new investment ideas. Send in your queries on personal finance and investments at fwq@network18online.com. Get answers from our financial experts on FinWiz at these times, only on CNBC TV18.
Presented by National Stock Exchange.
As the auto industry gears up to rev up the economy, discover the latest trends in lightweighting at the 3rd edition of Auto Ancillary Show 2014, October 10th till 13th, Auto Cluster Exhibition Complex, PCMC Pune. Seminars on lightweighting on 10th October, 12 p.m. onwards.
हम दिल्ली वाले हम पूरे दिल से सब कहते हैं कि हम सिर्फ हाथों से बात अब नहीं करेंगे करेंगे तो सिर्फ ओनली रातों से बात ठोक देंगे तो दिल्ली वालों अपनी फुटबॉल टीम दिल्ली डायनामोस के कारनामोस के लिए तैयार हो जाइए ठोक देंगे।
Our second session is on innovation in insurance. So let me invite a veteran in the field to take the stage. Ladies and gentlemen, please join me in welcoming Managing Director and Chief Executive Officer of ICICI Lombard Health Insurance, Mr. Bhargav Dasgupta. Please put your hands together for Mr. Dasgupta.
You see, over the last 10 years, as this industry has grown, the health insurance industry, we all know that there's been tremendous change in the underlying healthcare industry itself. In terms of capacity, you see the number of facilities, number of doctors, number of hospital beds that have been increased, in spite of the fact that even then the total number is still low compared to international benchmarks. There's been change in terms of capability, in terms of the quality of treatment. You've seen outstanding development in that area. You've seen changes in context. By context, what I mean is that the overall awareness and understanding of the health issues are very different today than what it was in the last 10 years back. And if you look at the health insurance sector within this framework, again over the last 10 years, lots have changed. This industry was really a very rudimentary industry which was just beginning to take the first baby steps. As we speak today, last year this industry was a 17,620 crore industry. Over the last 20 years, the industry has grown at about 28% CAGR. But something which is even more heartening is, in the last, I would say, about 5 or 6 years, more than 300 million people have been covered under various social insurance schemes of the government. And there was a talk about, universal healthcare when Dr. Panda spoke. One of the biggest innovations that has happened in the Indian industry, in the healthcare industry, is the initiative called RSBY, which the central government drove over the last 5-6 years. With its various pluses and minuses, at the end of the day, that's actually provided treatment free of charge to 5 million people in the last 5 years. That's a remarkable progress, something that even the World Bank has acknowledged as an amazing journey. But if I look ahead over the next 10 years, what are the changes that we see? What are the innovations that we see in the health insurance space? I would argue that there will be changes in the three key areas. One is in the area of product. If you look at the entire healthcare spending for the country, about 30% of the healthcare spending is inpatient care, where you actually get hospitalized and get treated in a hospital. 70% of the spends are outpatient. And if you look at the health insurance products, there is not a single product today which addresses that 70% of the market. So a market which is this size, as an industry, we've kind of narrowed our focus down to a very small sliver of that industry. And there are very genuine good reasons why the industry has done that. There's been concerns about misuse, abuse, overuse, lack of controls, frauds. But our submission and our view is that today technology is changing. Today the supply of quality physician networks is changing. And that is creating an opportunity for the industry to address that 70% of the market. I believe as we go along over the next 5 years, we'll see tremendous change in this domain, where the industry will begin to focus a lot more on other aspects of the healthcare space rather than just the curative care that it has been focusing on till now. The second area within the products and service space where we see a lot of change is again in the area of preventive. Everyone, all of us understand that the awareness of health is significantly increasing today. You just go to a Sunday morning in Marine Drive, you'll see the number of marathon runners and you'll know what changes happened. What we are also seeing is that corporates are getting more and more conscious about the need for providing holistic and preventive healthcare services for their employees. The second domain of innovation that we see happening very, very rapidly is in the area of service. And when we talk about service as an insurance company, our service is really the claims that we pay. That's what the product is really. One of the things that we saw when we talked to our customers was that at the time of discharge from a hospital, you want to go home as soon as possible. And the concern was that it takes a lot of time for an insurance company to process the paperwork. So we said it's a simple process. So we said, if you have your mobile number, I will send an SMS to you when I get all the papers from the hospital. Let's say I get it at 11:03, and within 1 hour, I'll process it and send you an SMS back at within 12:03 saying that it's been cleared from our side. Remarkable feedback from customers. And this is being made possible because of technology and low cost of technology today. My belief is that you will see significantly higher changes in the claims service side, where you will see auto adjudication, you will see artificial intelligence based processing, which will improve the speed and the experience of customers. So that's the second area where we will see a lot of innovation. And the third area where I believe we will see innovation is some insurance companies will play a more active and a larger role in the entire health consumption behavior of customers. Not just in terms of products that I talked about, but one of the issues that when we talk to our customers is that they're getting increasingly confused with the scale of choices that they're getting, the amount of information that they're fed with, and the lack of believable information out there in the market. And in healthcare, as we all know, there is huge asymmetry of information between, let's say, a hospital and a patient. And they're seeking help and guidance from someone that they can trust. And that's increasingly a role that someone will have to play. And my belief is that some health insurance companies will be able to play that role. These are some of the changes that we see happening. And our belief is that over the years, we will see tremendous improvement in the engagement that you will see with consumers and the insurance companies. Thank you.
Let's football! Let's football!
हीरो इंडियन सुपर लीग 12 अक्टूबर से हर शाम 6:50 पर.
Hey man.
Hi. Hi. Wow. Lovely earrings. Look, Varun, stunning, na?
अरे भाई, इनके पतिदेव ठहरे इन्वेस्टमेंट बैंकर. इनके लिए डायमंड इयररिंग्स क्या चीज है?
अबे साले, 6 महीने से घर पे बैठा हूँ. लॉयर मैडम घर चला रही हैं.
Aha, so you're the man of the house.
Even better. I'm the woman of the house.
नई रोशनी, नया विश्वास. पीसी ज्वेलर, नए जमाने के हीरे.
BSE Investors Protection Fund presents CNBC TV18 Investor Camp.
Powered by CNBC TV18.
you need a wash too.
The new generation Scorpio.
Our next speaker is a vice chairman of a pharmaceutical company that has grown from strength to strength, always exemplifying the entrepreneurial formula for growth. He is here to share his company's vision and dreams of innovation. Ladies and gentlemen, please join me in welcoming the vice chairman of Lupin, Dr. Kamal Sharma.
I'll very quickly like to touch upon what Lupin has been doing in this area. Way back, Lupin is about 47-year-old company. Way back in 1988, we started Lupin Health and Welfare Research Foundation. Currently, this foundation touches about 2 million people in the country. The promoter, chairman of the company comes from Rajasthan. So the first experiment was started in Rajasthan. And thereafter, we expanded this program into most of our manufacturing centers in the vicinity there. So you have this program going in Gujarat, in Maharashtra, in Madhya Pradesh. And this is a very, very successful program. We have just created a Happy Lung Alliance with some of the chest physicians. Currently, there are about 270 spirometers that we give out to the doctors for testing the lung capacity. And they are able to diagnose asthma and COPD, with the help of that. We also have our own spiromen, in Lupin. There are about 150 at the moment who go to different clinics where the spirometer is not available, and they test for asthma and COPD. So that's a very interesting initiative which is going on at the moment. In cardiovascular illness, I think with collaboration with the European Society of Cardiology, we have built 23 clinics to educate people on heart failure. And I was telling you this, that a lot of people die because they do not understand that they are actually having a compromised heart, and they continue to do things which otherwise they should not do. And this is picking up an excellent experiment today. Similarly, we have another program called Hamrahi, where we have 31 educators in the field who are educating people in camps about the awareness of diabetes and how to prevent it. And we believe very firmly in our company that it is the awareness which is eventually going to help the entire cause of good health delivery. Tuberculosis, you might know that Lupin started with tuberculosis as this early entry. I think the commitment of the chairman at that time was to provide, because this has been a very debilitating illness. And unfortunately, despite such long history, we still have 20% of world TB cases in our country. And similarly, we have plenty of chronic disease camps all over the country to make sure that people are educated about prevention, about better health care, and about better diet, nutrition, exercise, so that they do not have they do not have to go through the illness itself. I just wanted to share with you the case study on tuberculosis, because that has been one of the oldest commitments of the company in the country. As you might be aware, there are 8.6 million people in the world who suffer from TB. 20% of that load is in India. There are about 940,000, short of 1 million deaths which happen because of tuberculosis. And again, 20% of that is in our country. Today, we are the world leaders in tuberculosis. We have almost like 54% of the world market. Not only in India, we also supply huge quantities of anti-TB products to GDF, that is WHO, and also to the other programs under the Global Fund for Eradication of TB, Malaria, and AIDS. The latest that we have started working in this area is a program called LIMIT, which is Lupin's initiative for managing TB in India. And this was because we continuously keep thinking as to how to improve the awareness of people and the kind of delivery of healthcare. What we found here is that out of the 4 people who suffer from tuberculosis, only 1 is detected. And 3 go undetected, who go and then infect other people. And that is why this is spiraling, this whole, despite whatever I've spoken about. And therefore, we started a program. We have taken help of government bodies as well. And Lupin is in the front of this entire initiative. And before we roll out at the national level, we have just taken a pilot. This is as recent as about 6 months old initiative. We have taken a camp in Govandi, and we are doing this entire education program in Govandi, in Dharavi. So once we get a complete understanding of how people are receiving it, what all fine-tuning is needed, we intend to roll this out at the national level. So I think Dr. Panda mentioned that at the end of the day, whatever we do, all our actions put together, be it in infrastructure investment, be it in medicines, be it in education, I think we should be able to deliver value care. And what is value? Value is worth divided by the cost. So it should be worth the money that I pay. And I think the attempt of all of us who are connected with the healthcare should be that. That's the presentation that I want to make to you. Thank you very much. Thank you.
Catch the brightest minds from the healthcare industry speaking about how they have made a difference to the healthcare sector positively.
Focus. Ideate. Innovate. Enable.
Presented by ICICI Lombard Health Insurance. Journal partner, The Indian Practitioner. Exclusive media partner, Medgate. Magazine partner, Drug Today Medical Times. And Healthcare Executive. On-ground partner, Inox.